A very good afternoon, ladies and gentlemen. I'm Garchini Murugesu, your host for this afternoon. Hope you all had a good lunch break. So, welcome to the afternoon session of MPS Virtual Day 2022. I believe all of you had an informative morning session, getting to know better of the chapters we have in MPS. We are going to continue to know more about a few more this afternoon. So now, without further ado, let's move to the first session for this noon, which is the Hospital and Clinical Pharmacy chapter that will be presented by, once again, Puan Sharifah Nadia, and another speaker will be joining her as well, Miss Susan Pan. So please include your questions if you have any in the Q&A box, just like you did earlier this morning. And please remember to mute your microphones throughout the webinar. So let's welcome Puan Sharifah and Miss Susan, please.
Thank you so much, Ms. Kartin, for the kind introduction. And good afternoon, everyone. It's really glad to see all of you here, especially on a weekend. I hope that you had a good meal. So both myself and also Puan Nadia, we are the co-chair for the MPS Hospital and Clinical Pharmacy chapter. So next slide, please. So our chapter, we comprise of pharmacists who mainly work in hospitals or other related medical institutions. It could be ambulatory care centers, private specialist centers, or some of us also come from Institute of Higher Learning. So some of us, we have got interest in clinical pharmacy. We currently work in the wards in hospitals, closely alongside doctors to manage inpatient care. Some of us are more involved in the management and also the administration of the pharmacy department in our workplace. So maybe not so much into the practice of pharmacy, but more into the management and administration of pharmacy departments in bigger hospitals. Some of us are educating pharmacy students in higher institution of learning in the area of clinical pharmacy and practice. So even though we comprise of pharmacists with very different job scopes, we all have got interests as hospital or clinical pharmacists because that is where our work environment is, and we come together because we want to connect with each other so that we can help each other to become better pharmacists and to be able to deliver better care for our patients. So we come from different backgrounds. We have got different responsibilities at work because hospital pharmacy, as you know, is a big institution and organization, and there are many components to it, but we come together because we want to help each other out and see how we can improve the quality of care at our workplace. Next slide, please. Okay, so this is our committee lineup. As you can see, Susan, that's me. So I come from background of private practice, and we are quite heterogeneous in what we do. We've got specialist clinic, IVF, pharma distribution, maternity center, and things like that. And my co-chair, Puan Nadia, she's a clinical pharmacist in HSNZ in Terengganu. Our secretary is Dr. Nusaiba. She is currently the head of department for clinical pharmacy and pharmacy practice at the Faculty of Pharmacy in UM. And our core committee members, we have got Mr. Teo, who's the clinical pharmacist and head of Pharmacy Resource Info Center in Langkawi. We have got Dr. Chong, he's a lecturer in IMU. We have Mr. Ong, he's the chief pharmacist in HPKK in UKM. And we have Madam Tan Titi, who is the chief pharmacist in KPJ Pasir Gudang in Johor. So our committee, we come from different backgrounds as well, and we bring different expertise to the table. Next slide, please. So what is the aim of the hospital chapter? Our aim is very much to enhance the provision of hospital pharmacy care services and standardized hospital pharmacy practice across Malaysia. So we have got 3 objectives, and the first one is to ensure competency and up-to-date practice of hospital pharmacists by organizing workshops as well as providing valuable resource and materials for clinical and pharmacy practice. Secondly, to observe the current practice in hospital pharmacies and to reduce discrepancies so that we can provide a benchmark for hospital practice across the nation. And thirdly, to provide assistance, support, and promote engagement and ultimately the voice of hospital pharmacists in Malaysia. Next slide, please. So these are our 2 main advocacies for this term. We are looking into MHQH accreditation, and I believe this is mainly affecting the private sector, private hospitals, private hospital pharmacies, where they have actually come together to discuss on the MSQH standards and how it can be adopted to ensure safe, effective, efficient, and improve quality use of medication and its medication management. And also, Mr. Teo, he is heading the next one, which is how can clinical pharmacy specialization be recognized? And this is something that clinical pharmacists with MPS certification are looking into. Next slide, please. So these are a few of the activities that we have done in our past. So this is how life was like for us before COVID happened. So as you can see, you can happily meet each other face to face, and you had lots of fun times learning together, getting to know each other and networking. We have made visits to Sunway Medical Center where we had a look at their automated dispensing services which they had in their inpatient. And we also had Puan Rosmalia, who is a geriatric trained pharmacist. She helped us to organize the Medicine and Falls workshop for pharmacists in conjunction with the First World Congress on Falls and Postural Stability. And we also had a visit to UKM to visit their clinical pharmacy stimulation lab. So these were some of the activities that we have done in the past pre-COVID times. So now I'll pass the time over to my co-chair, Puan Nadia, to continue on.
Thank you, Susan. So, okay, so this page is also a continuation. Can you hear me? Can you? Okay, so this is actually a continuation during COVID. Okay, so we didn't stop meeting online. Okay, so basically what we do for COVID, because most of our pharmacists are actually affected with the practice in handling COVID. So we actually created inpatient pharmacist roles. We've been having seminars on inpatient pharmacist roles, the important advocacy webinar for pharmacists, as well as preceptor training discussion, because this is considered as one of our advocacies as well, to have a standardized training. And also, we also had the meetings involving private hospital pharmacists conducted on discussion with MSQH standards, and as well as discussion with the BCPS holders on the advocacy of recognition of clinical pharmacists with BCPS. Okay, next page, please. Okay, so for our upcoming activities in 2022, we hope to meet you in person or hybrid or online for our for 2022 and beyond. Okay, so our business meeting, we are planning to do ours on the 4th of March in the afternoon. Later, we will reconfirm on the other information. We are also planning for the preceptor training. Okay, it's actually a research project. So whoever's interested in research, you are most welcome to join us. We're also having initiatives on the resource of hospital pharmacies, basically on getting information, okay? Because we are in charge of information center in most of our hospitals. For charity drive, we also have blanket project, which is head by Mr. Ong. Pharmacy specialization, and also AMS training, antimicrobial stewardship. Then, and we, of course, we are most open to waiting for you all to come and join us to actually create more activities and suggest more initiatives for us pharmacists, hospital pharmacists. Okay, next page, please. So how can you contribute? Okay, so become one of us and share opinions. We are all, as you know, we all come from different backgrounds, so we may have different opinions and different ideas from our practice, and come join us so we can share. Okay, and collaborate with us to provide suggestions and to improve the services for patient care and recognition of pharmacists. We can also offer our expertise among hospital pharmacists, okay, among us, okay, just to share information, and also to make us stronger in voicing out our opinions and suggestions for improvement of pharmacy practice in hospital. Yeah, so next page, for if you are interested to join us, kindly contact us using our email address. You can contact our chapter email at mpshpc@gmail.com, or you can personally contact us at me or Miss Susan. Okay, so thank you very much. Susan, you have anything to say? To add on?
Thank you, Puan Nadia, for sharing. Basically, the hospital and clinical pharmacy chapter, we are very much for the people who join us. Maybe sometimes you have got certain initiatives or ideas which you want to what you want to do, you want to execute, but sometimes perhaps the current workplace or the current environment you are in is not able to facilitate you to do that, or maybe you need more help from other people to come alongside you and to try to make an idea become a reality. So I think that's where the hospital chapter comes in, because we are all in hospital practice together or have an interest in clinical pharmacy. So we can help each other out, bounce ideas. Sometimes maybe some places have already got certain things in place in your workplace, so we don't need to reinvent the wheel, but we can see how we can help each other out and share resources as well. There's a question, I believe, in the chat. Maybe I'll let Puan Nadia answer that, as she's a clinical pharmacist now.
Okay, actually, there's too many ways to answer this question. Maybe you can actually email us and explain your condition, and then we can discuss. Basically, to become a clinical pharmacist, we can actually, we will have to go through a few trainings and all before becoming a clinical pharmacist. Okay, but that's the general. Okay. So
next question.
Does the training provided applies to all hospital practitioners or for future clinical pharmacists? It's actually open for all it's open for all pharmacies, right, Susan?
Yes.
But
yes.
we cater more for hospital pharmacies. You have to understand, because in hospital it's not just the clinical, but everybody is doing clinical in a way in the hospital. So yeah, it is more, we cater more for hospital pharmacies.
Yeah, so I think there's many ways to also answer this question, because we have got fresh grads who are now maybe in a ward, so you have to join them for ward rounds. So you do need some sort of clinical knowledge. And we have got maybe experience in specialized pharmacy who've got their masters in specific fields like oncology. So sometimes we would have different trainings. Maybe for fresh grad, it will be more theoretical based, and then for those with a bit more experience, we can look into case studies and workshops to see how we can share our clinical practice together. Okay, our time is up, I believe.
Okay.
Thank you very much.
Okay, thank you very much, Puan Sharifa and Miss Susan. I hope all of you understand better about the hospital and clinical pharmacy chapter. So there's a lot of interesting activities, and those interested can approach them.